In a country well governed, poverty is something to be ashamed of. In a country badly governed, wealth is something to be ashamed of. Confucius.
Can you imagine you're living in a world where your biggest problem isn't your broken iPhone, but your broken arm? Just think, how would you feel if you couldn't afford medication for a deadly infection that can be cured? How would you feel if you knew this was happening in your backyard?
In Indianapolis alone, hundreds of thousands of people are in this situation. We propose a solution that fixes the problem more directly than taxing the rich.
363,000 Hoosiers are not eligible for health care benefits. The cost of health care can push people farther and farther into poverty. Although many businesses provide health care for their employees, there are still many people who don't receive these benefits.
For example, a business owner, Cheryl Pass, cannot afford health care for herself, her family, and her employees. The current solution is to tax the rich so the poor can get treatment for medical issues. However, the rich criticize the high taxes that are being bestowed upon them.
23,000 U.S. citizens die every year as a result of easily treatable issues due to the lack of health care. Just in Indiana, 29% of the people under 65 don't have health insurance. 53% Latinos/Hispanics, 42% African American, 26% Caucasians don't have health care. Also, 77% of the employed don't have health care.
Some consequences of health care are financial drain, higher risk of death, bankruptcy, and income loss. The greatest cause is expensive and rising costs. Because of these costs, 9% lost health care insurance. Costs rose 50%, and personal expenses rose 83%.
Due to the rising cost of healthcare, our government is increasing taxes on the rich. The rich don't consent to paying for the healthcare for those who cannot afford it. If the amount of primary care physicians who are willing to receive less money for their services increases, then more people could receive necessary healthcare.
By forcing all medical students to contribute their skills to those who cannot receive healthcare, the amount of people who can receive the benefits of healthcare would increase. Medical students could have a mandatory internship that requires all students that plan on joining the medical field to assist those without healthcare.
In Israel, every citizen is required to serve a minimum of 2 years in the military. This program is extremely successful and contributes to Israel as a nation. To inflict our new policy, it would be necessary to inform students and colleges of the new mandatory internship.
After getting support of the schools, a location would need to be chosen for these new specialized hospitals. Lastly, we would need to spread our new program to the public. The results would dramatically increase the amount of people who would receive medical aid. The new program would not only help those in poverty, but also would give the students more experience.
Many people in Indianapolis cannot receive necessary health care, and by allowing interns to perform medical treatment on those who need it, we could work together to eliminate the healthcare crisis among the poor.
Wealthy men can't live in an island that is encircled by poverty. We all breathe the same air. We must give a chance to everyone, at least a basic chance. Ayrton Senna.